I'm not trying to be alarmist here, but I think this was helpful. I said, everybody's going to get this. Everyone is going to get this illness. It's a question of, do you get it in March? Do you get it in April? Or do you get it in May or June?
And so coming out of Italy, there are doctors and hospital administrators that are completely overwhelmed, especially in a couple of the regions, the Lombardy region, down in Venice as well, where they are, the workers are there, some of them on 18, 24-hour shifts, the doctors and the nurses. They're making very difficult decisions as to who is going to be treated and who's not.
Right.
They're at that point. They do not offer any respirators for anybody over 65 years old.
They're just overwhelmed.
They're just overwhelmed, and
they've got to make those decisions based on. I mean, they're in a horrible position of a shortage of equipment, with an overwhelming number of patients who are ill and in need of respirators. It's awful.
Right. The other thing that goes on top of that is maybe the next level, where you end up with another huge problem here, is with the doctors and nurses. Some of the reports coming out of those regions are that as many as half of all of the nurses and doctors are infected. And so I don't know exactly what the measures are that they're going through right now, as far as, seems to me like you have to almost assign a hospital as a coronavirus hospital. And anybody who's already infected, maybe they're working there as long as they can. But, these are doctors, and you were an ER doc for a long time. Imagine you bring somebody in who's infected, and then right from there, you go to somebody who's had a heart attack and you're treating them. How do you possibly manage something like that?
So historically, the way that you manage something like that is, if you have an outbreak of this magnitude or something that is particularly infectious. Measles is actually the worst thing as far as number of people or how infective it is, infectious. If you have something like that, you're usually able to isolate those patients by the room that they're in, the clothing that you wear, and the number of people that are allowed to come in and see them. So you try and contain it. You try and put them in a special bubble as soon as you know that they have it. One of the big problems with this disease is people have it for 7-10 days before they necessarily have symptoms. So that first week, at the least, they're out sharing this virus and potentially infecting other people, which is why the testing idea is a bit flawed, and we can talk about that in a bit. But the problem is, we don't have enough tests to test everybody, so we have to test just some people. And to your point about what do the healthcare workers do, for my understanding right now, there are two groups of people who really need to be tested. The first group is people who are profoundly ill and need to be admitted to the hospital regardless of the reason. And those people need to be tested so you know where to put them. To your point, and we may get there, we're looking at that here locally. You may want to describe, or you may want to assign certain parts of the hospital, certain wings, certain ICUs that have patients with this disease, and people who don't have that disease go elsewhere. So inside the hospital, it's really important to know if these patients have the disease. The next thing is healthcare workers. If you are exposed to this disease and you're worried that you have it, and the answer is, hey, you're healthy and you're doing okay and you don't need to be admitted to the hospital, you wouldn't normally get tested unless, this is just the second group, unless you're a healthcare worker, because we sadly don't have an unlimited number of people who can work the shifts as nurses and doctors and other personnel. And if you're sick, or if you're exposed, or if you think you're been significantly exposed, you should quarantine yourself for 14 days. So since we don't have enough staff for people to just go home for 14 days repeatedly, that's a group that needs to be tested because we need them to come back to work. To your point earlier.
What would you expect, though? I mean, if let's say that you get to a position, you're system medical director over St. Luke's Health System. You have 7 hospitals that you're over.
Right.
I'm guessing somewhere around 800 beds or so.
Yeah, that's about right.
About right. So if you have your healthcare workers, what if you put everybody, it was an all-out alarm and you had everybody available, I'm guessing they could handle those 800 beds.
Yes.
Okay.
Normally we handle all 800 beds. We're fine. We
okay. So what if you end up with 1,200 people in the hospital?
Then it becomes a problem because we don't have the place to put that many patients. Certainly not each in their own room, and certainly not with the sort of precautions that you normally take to separate people. So we don't have room for 1,200 people.
So right now, the way you see it, as far as even a plan for going forward, you do not have the capacity to go beyond that, or would most hospitals be in the same boat?
I think so. One of the weird things about hospitals is you have to be able to demonstrate a community need to build a hospital. You have to, it's almost like you can't, let's see, what's an analogy? If you want to build a restaurant, you have to find someone to finance you. And if the bank thinks you're a good risk, you can often get a loan to do that. But if you want to build a hospital, you have to demonstrate that the community needs those beds. So you can't overbuild the hospital. You have to build it in response to the community needs. So we are frequently behind the number of beds that people might need, and we are certainly behind if there's a catastrophe like this.
Well, it seems like it's not even that big of a catastrophe. I mean, if you had mentioned that you're usually somewhere around 85% occupation in those beds.
Right.
So you have about 80 to 100 beds that may not be filled on average.
That's fair.
And that may not take a whole lot to fill another 80 to 100 beds.
That's not a lot of wiggle room.
That's not a lot of wiggle room. And would you say most hospitals are in that then because they're built to meet the need of the region, of the area there?
Right.
Then do they mostly run probably about that amount, 80, 85% occupancy?
It varies season to season and varies hospital to hospital. Those are sort of national averages, and that's been my experience in a couple different parts of the Southwest. That's about where we run. You know, different times of the year, respiratory season. Right now, influenza is still a big issue. We're busier than we commonly are in, say, July and August, where it's not respiratory season anymore.
What is your access to testing kits right now?
Right now, we have the ability to test patients who are needing to be hospitalized through the state laboratory. We also, a few days ago, opened up sort of drive-through testing facilities at many of our hospital sites or near our hospital sites, where you can go and get tested for coronavirus. Really is the only thing that you can get tested for. They come to your car and they swab you and they send it off, and you usually hear in 4 to 5 days. I have friends and colleagues who've heard in as many as 8 and as few as 2.
Is that crowded right now? Are you getting a lot of that going on? A lot of drive-through?
We started it this week, and the first day it opened, I think there were 200 patients who drove through. Wow. in I'm going to say an 8-hour portion of the day. I want to say it was 10 a to 6 p. We had it at 2 sites, and then each subsequent day we've opened 1 or 2 more additional hospital sites, and they're just running all day long. So
you said that the testing is a little bit flawed.
Yeah.
What do you mean by that?
Well, I don't think we know yet. Let me back up just a little. Usually when we have something like this, like a rapid strep test or another viral test of this nature, we have a fair amount of lead time. We add a certain test. RSV comes to mind, which is part of respiratory season, which my grandson had this illness a few months ago. It's extremely common. It's a test that we're able to run similar to the other ones I'm talking about. But the benefit of it is we know how sensitive it is. We know how good it is. We know that you have to get a really good specimen. We know that sometimes if you don't get enough of the cells, you can miss the necessary material to have the test work well. We don't know that about the coronavirus test yet. It's so new. I've not seen data about how good it is, or how many cases it might miss out of 100. We, I believe, have different tests here than they have in other countries. And let me just back up a little. So I'm going to be somewhat facetious here, but I'm actually really serious about this. If let's say you're worried you've been exposed, and you're a healthy person and you're not having really any significant symptoms, but you're worried that you're exposed because you want to know if you have this test. And you go and you get swabbed. What you should do while you're waiting for those tests is quarantine yourself for 14 days while you're waiting for the test. It's very possible you'll get a result back. Let's say 5 days into it, you get a positive result. That means you should finish the quarantine for the remaining 9 days, so that you've been out and not out of the loop, I should say, and you're not spreading it to other people. So that's pretty simple. But if your result is negative, your first job is quarantine yourself until you know that it's negative. And in many situations, the best thing you can do is just stay out of the loop for the whole 14 days anyway, so that you're not possibly infecting people, and trying to just keep this at bay as best we can. I guess what I'm saying is, if your test is positive or if your test is negative, if you're sick, stay home. And if you're worried you have it, stay home for 14 days. That's really the best advice that I can give at this point. I am kind of leaning on my extended family there, because not everybody believes it, or not everybody feels like it applies to them, but it does. You really just want to be taken out of circulation so that you're not spreading the disease.
So I was going to go over that later, but let's go ahead and talk about that right now. What I see through the news and through, things online is that there's kind of these two camps that have developed now on opposite ends of the spectrum with this. And there's those that are, very fearful. My wife was talking about some people she knew that were really, really scared about what's going on, younger people. And, there's a lot of fear of what's going to happen. I mean, what if I get infectious? And there's, they're going to act in their behavior a little bit more. They're going to quarantine more. Yeah. Right. They're going to be more quarantined, which is probably a good thing. And then on the other end of the spectrum, you see this quite a bit. I mean, everyone from the kids at spring break and on the coasts and beaches out in Florida to others that are just kind of defying, hey, look, I mean, I'm an American. I'm not going to be told what to do. And this is completely overblown, and this is going to pass. And look at the deaths that we have compared to what we have with the flu. It's nothing compared to the flu every year, right? I think there's 30 to 70,000 typically deaths a year in the U.S. Just from influenza. And so they're doing the opposite. They're just kind of like, you're not going to hold me back. I'm going to keep going.
I'm healthy.
Where should somebody be in that spectrum?
Man, I would like it if everybody got scared and hunkered down in their house and just waited. So, and I'll tell you why. If you think about how toilet paper was a couple weeks ago, maybe it was just last week, and I'm delusional as far as how time passes. But if you think about the run on toilet paper, what we're trying to avoid is a run on hospital beds.
Yeah.
People here in the United States are used to getting the attention they want and need whenever they want or need it. And I would love if that were the case and nothing got in the way of that. I'm worried with this pandemic that we're going to have problems. That hopefully we don't get anywhere near Italy or China. hopefully we can do something more similar to what Japan has done, where they say, hey, you need to stay home, and through whatever means people are staying home. I would like more people to stay home and take this really seriously. And let me tell you why. If you think about influenza, it comes around every year. You're right. 50 to 60,000 people die every year. This happens to have so far been the worst year in the last 15 for death among children, which is my main focus. The challenge with the flu is everybody's seen the flu before. Everybody gets the flu. You know, you get kind of achy. Sometimes you have to take a couple of days off. Sometimes you vomit. Sometimes you get short of breath. But your body has seen the flu before. And whether you have gotten immunized against it or you just get it every few years, your body has seen it before. This new virus, COVID-19, your body hasn't seen it before. So we have no idea how people are going to respond. Some people have very few symptoms. Some people are sick enough to need some additional oxygen. Some people, a small minority, 5% of people, something like that, need to be admitted to the hospital, and then 2 or 3% of the whole group dies, which is horrible. And influenza has a death rate that's 1/10 or 1/20 that high. So the challenge with this illness is our bodies haven't seen it before. We have nothing to rely on. The ways that you're able to fight off an illness like this are really just three. You have passive immunity through a vaccine. You have active immunity from your body building antibodies after your exposure. And the third way you get through this illness is you totally avoid it when it comes through your town.
What if it comes back? What if it comes back next year?
I think it's going to come back. I think it's just going to keep cycling like influenza does. I don't think this is a one and done. I don't think that I'm inventing a little here because we don't really know. But my suspicion based on other viruses is that this will keep circulating. And we have to hope that we get through the first wave, and the next wave, we're a little more ready for it because many of the population has had it already and they're immune to it. And we can get to a point where it doesn't circulate so well and it's not so horribly contagious because many of us have had it already. But right now, we don't have the option of any sort of herd or group immunity at all because outside of certain other countries, none of us have seen it before.
So we might see an example next year. Let's say this, I mean, just looking forward a little bit, where this comes around again, maybe not. I guess we don't even know about the summertime, if that's even something that's going to make a difference at this point. Typically does with the flu. But let's say it comes around again next year, flu season, let's just say. There is a little bit of herd immunity then at that point going into next year. On the other hand, it could mutate as well. And we have different strains. I believe there's already 2 different strains, that one's more aggressive than the other, but could also mutate. And is that going to affect people that have already had it before if it mutates? Yeah,
probably. I mean, that was, I'm going to shudder a little bit. That was why H1N1 was so bad back in 2009. Is the virus mutated and made a big enough jump from where it had been as far as the antigens and the proteins. It made a big enough jump that people who had seen flu for many years weren't ready for that and weren't able to fight it off particularly well and got exceptionally symptomatic because the virus had mutated enough that their prior year's practice, if you will, wasn't helpful at that time.
I wonder what, I haven't looked at it, but I wonder what the numbers are as far as deaths go for those that, from the first season to the second season, the H1N1 coming around again.
Yeah, I've not seen that. I haven't looked at that specifically, but I suspect that there's quite a bit of herd immunity that develops and decreased mortality and problematic cases the second time it comes through because of both the group immunity and individual immunity.
Now, you talked about the run on toilet paper and using a metaphor of that to the beds and all the healthcare, let's just say healthcare in general. For whatever reason in your region, you had a run on ibuprofen, which actually, from everything I've read, is actually something that irritates the virus.
It seems in the most severe cases of this virus, like other really severe cases of viral infections, that ibuprofen tends to cause people some more trouble than it's worth. And in the most severe cases, it's not the go-to drug. The challenge is for many other people or other illnesses, it's a great drug, but in the most severe cases, it seems to be really problematic. I'll tell you, as an emergency doctor, I'm a big believer in ibuprofen for everybody, for everything.
Yeah.
So I have to be careful not to.
And so it might just be that there's a run on it because they don't know if there's going to be any available, just for people that get headaches or everything else.
And our biggest problem here locally that we're actually addressing now with our pharmacy teams is children's ibuprofen suspension. That's what we had the trouble with. In fact, you could go to Costco or Walmart right now and get a jug of ibuprofen. You just couldn't get a big bottle or a few bottles of children's ibuprofen.
Well, where are you guys at in terms of, if you had a run on the hospitals with other medical supplies, respirators, masks, etc.?
Yeah, we have all we need in the way of respirators right now, or ventilators, we commonly call them. In the news, they're commonly referred to as respirators, but I'll try and use ventilator because that's the term I use more. We have all we need. I believe we're trying to get more because we expect the need to go up over the next weeks to months. We have a handful of days of the various types of PPE or personal protective equipment. We have historically bought those in 3 to 7 day aliquots. You just always keep enough on hand for the next few days. We have not historically had a month's worth of those materials. We're trying to get more than we usually have right now. If we back up to your question earlier, if somebody has the COVID-19 coronavirus now, you figure the number of people who have donned, is our fancy word for putting on, if they've donned PPE, it's an unbelievable number of people who need to put that on just to take care of that patient each day. So if you have your normal operating number of PPE masks, for example, and then all of a sudden you have 10 or 20 patients in your hospital who have the virus, where you need to don this stuff all the time, suddenly you're going through 10 and 20 of those sets each day for that patient. And that's the problem. That's why we have to ramp up what we have on hand. And that's why we're looking at everything we can to get more.
Now you guys have gone through trainings in the past where there might be, whatever it might be. I mean, you a massive accident or, I don't know what other crises might come up where you have training for the hospitals to bring in a lot of patients at once, right?
Yeah.
So there is some preparation and training involved with the hospital systems for this. What might be different about this as compared to some of the other things that you guys have already trained for?
Yeah, that's a great question. So what we train for is a mass casualty event. You think of something like a school bus being hit by a train, or I remember in San Diego where I trained, the concern was always a cruise ship comes in and 40 people have food poisoning. We had a marathon complete disaster when I lived in San Diego, where unfortunately they ran out of food and drink at mile 20, and there were a lot of patients all of a sudden. So you train for those because I think those are a little bit more expected. We did a handful of years ago ramp up everything when we thought Ebola was coming. We went through these exact same discussions about ventilators, about segregating patients inside the emergency department, inside the hospital, about where to place them, about what to do, about backup staff, about all of these things. So this certainly isn't the first time we've talked about it, but it is the first time where we have a handful of foreign countries who are saying, we did not do this well, and here are the 10 things that I think you should do so you don't get to as bad of a spot as we have gotten.
Okay. What is the, this seems to be a very selective virus where it hits the elderly quite a bit. There might be some obvious reasons for that, but there are more than double the number of fatalities so far are men. It hits people with cardiovascular disease. That might be obvious as well. Other respiratory issues, that's probably obvious. But diabetes is another one too, that where people are hit very hard. A lot of fatalities with people that have diabetes.
Right.
What are some of the reasons behind this? Do we know that yet? Do we know what? And hardly any children. I mean, I think the youngest person I've seen that's passed away is 14.
Yeah, that's the same one I've seen. We, in my children's hospital work, we look all the time. I was talking with or reviewing some information from Seattle Children's earlier today. I believe so far they haven't even admitted a child to their hospital who has popped positive for COVID-19. In China, I believe they had something like 10 patients in the whole country who popped positive. And they were not necessarily symptomatic people. They were family members of people who were admitted to the hospital who were probably in one of these groups that you're mentioning. So the interesting thing, or the scary thing is we have a number of people who are in the highest risk based on their other medical problems. Number one seems to be age, like you mentioned, and we can come back to that. The other ones that seem to be the primary risks are cardiovascular disease, pulmonary disease, and diabetes mellitus, like you mentioned. I haven't seen an explanation for those specifically, but I think it's fair to say that those are the patients who tend to have the highest complication rate with almost any infection. Mm-hmm. Unfortunately, patients who have diabetes, COPD, or coronary artery disease tend to have the roughest go of anything.
Is there a specific reason for the elderly other than just they're older, their immune systems might be more compromised?
I haven't seen a good explanation of why it's so dramatically different. It kicks up somewhere around age 60, and it pops up higher at age 70 and pops up even higher. I want to say it's between 18 and 20% mortality rate for patients who are 80. So 80 or more. So
that's what I've seen.
It's shocking that A, mortality is that high, and B, that it's so disproportionately high in that used to be so far away. 80 used to be unreachable. Now it's I can see it coming, but I still got a few decades. But it's shocking how much just age is a risk factor.
What about men? I mean, do you think that might be something where they probably there's a lot more cardiovascular disease perhaps with men, high blood pressure? Would that be a reason?
Those are very reasonable ideas. I haven't seen anything, or let me say that a different way. I haven't read anything from a medical journal yet that has really taken a good crack at why the mortality is higher in men. Mm-hmm. And that's weird.
Yeah. It seems very selective, this disease. So another topic, especially for a lot of our audience here, is LDS, and there's a certain group of people that are what has been coined as the anti-vaxxers.
Yep.
And it seems to me like this is something that might change people's minds a little bit if there were a vaccination that would come out for COVID-19.
Yeah, that'll be really interesting where the anti-vaxxers land if we get a vaccine for this illness.
I mean, because they're typically what you're relying on there, right? And you kind of understand on one side, okay, well, they want their independence and they want to be able to decide for themselves. as parents on the other end of the spectrum, they're really relying on everybody else to create that herd immunity.
Yeah.
Right.
Yeah. The only way you can keep going as an anti-vax person is if everybody else carries you.
Mm-hmm.
That's what it is. If the herd has an 85% or a 90% vaccination rate, you can get by not getting vaccinated, kind of like somebody who has cancer and can't get vaccinated.
Mm-hmm.
But once that number drops, and each virus or bacterial illness is a little bit different, but once that number drops enough, then suddenly you're getting that illness when you weren't getting it before, because the herd can't protect you anymore. Mm-hmm. So in a year, which is where I think we should start thinking about when this vaccine comes out, in a year, it'll be interesting to see where anti-vaccination folks land as far as whether they want this or not.
Well, another thing that's interesting about that is that a lot of that has to do with children.
Yeah.
Right. It's a parent saying, I don't want to vaccinate my children. And of course, this specific virus doesn't really affect the children very much.
Right. No, it seems to just pass them by.
Yeah. So there isn't a whole lot of change there. Lastly, what I wanted to go over. So with everything that you've seen here so far with this, I mean, really just surreal change that we're going through, you've got a family. Where are you really standing in terms of behavioral changes with where we are here on March 22nd for you and your family?
So I'm driving my family a little crazy,
mm-hmm.
But I'll tell you that I also made my kids wear helmets. I made my kids not jump on a trampoline with 3 of their friends. But at the same time, I take my kids kayaking. So I'm not totally averse to being outside and enjoying yourself. But this illness scares me. Mm-hmm. This illness scares me to the point that, for example, my wife hasn't left the house this whole week. Mm-hmm. Except one time she ran an errand with me and she stayed in the car.
Right.
My 15-year-old daughter has run a couple errands to go shopping. She's kind of having to carry us right now because I'm at work all day and most of the evening every day. So and I'm trying to get some of my college-age kids to come home and just hide. Mm-hmm. So that's how we're living, is doing what we have to do from the house. We had church in our living room.
Do you
today.
have enough toilet paper?
We have toilet paper. Yeah.
Good. Well, anything else you want to add here? Any points you wanted to bring up?
So I wrote down a couple things just to share. One is if you remember the Peanuts cartoon, mm-hmm. Think of everybody as Pigpen. Mm. If you get inside Pigpen's dust cloud, you're too close. Mm-hmm. And everybody is Pigpen. Everyone has this circle of goo around them. Mm-hmm. And that's what you need to avoid, is other people's dust clouds. Another thing that I wanted to share was a website that I found really helpful that has unbiased information, which is really hard to find. It's called Kaiser Family Foundation. I think it's affiliated with, but not owned by, the Kaiser company. It's just a really good source of objective, non-spun information. One last thing, I think the president has gotten some grief this week about referring to this virus a couple times as the Chinese virus or something along those lines. We call viruses all the time. We give them a name based on where they come from. It's a non-political thing. I think some people are offended, and we're being unkind to Chinese people. Well, it started in China. I mean, we call Lyme disease because it started in Lyme, Connecticut. Mm-hmm. It's not bigoted. It's not that we hate people from New England. It's just we do that with diseases all the time. Rocky Mountain spotted fever is another one. We don't hate people from the Rockies. It's just that's where that disease was found.
The Spanish flu.
Spanish flu, right?
Yeah. Yeah, it's kind of interesting because, as you saw reports of this coming out, you did see the media, if not Chinese, they called it Chinese virus sometimes, but usually the Wuhan, you
Right.
know, virus. And then for whatever reason, it all changed and flipped very quickly. But I don't see a whole lot of issues there with racism, but I think it's sad that on either side, that there is a politicalization of all of this. I mean,
Yeah.
this is a very serious issue, and a
Although
lot of people cannot shed their political filters. They just can't do it.
right, right. And it doesn't matter what party you come from, believe in, or support. You're probably going to get sick.
Yeah.
Another really good source is Dr. Fauci.
I think he's great.
He's phenomenal. I mean,
He
he's
is.
like, he's so straightforward.
Yes. He's so straightforward and full of information. And yeah, I pay a lot of attention to him. In fact, probably more than anybody else or anything else, I pay attention to him.
Yeah. He's the E.F. Hutton of the current administration.
Yes,
You say,
E.F. Hutton.
what did he say?
You're aging yourself there a little bit, but
yeah,
right.
Yeah,
So
I know.
what do you think we might be looking at in terms of that herd immunity this first year? What are we looking at? 20, 30, 40, 50, 60, 70, 80% of the country getting infected?
Yeah, based on the pictures of spring break yesterday,
Oh my.
I think we're in trouble. I think
Yeah.
we are in a lot of trouble. And it's not so much that actually I was talking with a bunch of my wife's siblings the other night, and what I said to them, and I'm not trying to be alarmist here, but I think this was helpful. I said, everybody's going to get this. Everyone is going to get this illness. It's a question of, do you get it in March? Do you get it in April? Or do you get it in May or June?
Mm-hmm.
I don't think that it's realistic to think if I just stay away, I'm not going to get this, because I mean, this is like the perfect virus for taking people down.
Because of the incubation period.
Yeah,
and
you have
severity
a
of it.
week to 10 days where you're spreading it, but you don't have any symptoms.
Yeah.
I mean, it's like it's worse than movies.
So what is, there's, for example, my understanding is that Denmark has taken a totally different tact on this. They're quarantining everyone over maybe, I don't know what ages is, 65, 67.
Yeah, I think they hid their elderly.
Yeah, they basically just, it's almost like metaphorically put them off on an island somewhere.
Yeah.
And then everybody else is kind of, maybe a few changes, but pretty normal day to day. And they're expecting herd immunity that way, right? And that almost in a way protects the elderly in the future, right? For everybody else to get the herd immunity. For us, if we're already going to all get this, is the only reason that we're doing what we're doing, I mean, because these are very drastic measures.
Yeah.
I mean, we're bringing the economy to a halt.
Right.
Is the primary reason the hospitals? Is the primary reason saying is that flattening of the curve?
I think the primary reason is spread this out so that we don't run out of beds.
Mm-hmm.
Hide so you get it in 2 months rather than right now, so that we don't run out of ventilators. I think the whole idea is not if you hide, you won't get it at all. I think it's, let's slow this down. Let's take many of the ping pong balls in that ping pong ball mousetrap video, take a lot of the ping pong balls out. Let's just make it so this slows down enough so that we can catch up. I will share that many hospitals, including my own, we have shut down everything elective. So what that means is, if you were scheduled to have your knee scoped, if you were scheduled to have a shoulder replacement, if you were scheduled to have repeat surgery for your chronic arthritis or your sinusitis that hasn't healed in a year, and you were scheduling this out 3 months from now, those cases aren't happening.
Mm-hmm.
We are in the process of canceling or delaying everything we possibly can so that we have manpower and rooms to take care of these patients.
So then really though, I mean, if again, just hypothetically, if everybody's going to get this and this virus is selective in who it's going to take out, so to speak.
Yeah.
The only difference then is I mean, to me, as I think about that, the only difference in doing what we're doing in our behavior here, in quarantining, et cetera, is the number of fatalities that we are going to have with this virus without the help we need in the hospital, compared to the number of fatalities we're going to have if that's a lower number, which should be, if that's going to be a lower number, if we have more, if everybody hopefully can get the help they need at the hospital. That's really the only difference, because there's going to be a number of fatalities regardless,
right?
If everybody's going to get it.
Right.
So what we're saying is, if everybody were to have a chance to get to the hospital who gets it, then maybe we have a change in the number of deaths between those that get the help they need at the hospital and those they don't. Is that probably a big number?
I don't think we know.
Yeah.
I haven't seen that number described. I think that's a great question. Mm-hmm. But if you think about what you mentioned a little bit ago, where Italy is saying, hey, we're really sorry that you're horribly sick. We're going to take care of you as best we can, but we are out of ventilators, or we're not placing patients on ventilators who are 70 like you are. Mm-hmm. So we're really sorry. I think that would cause hysteria here. Mm-hmm. Just like I expect it's causing hysteria there. I don't think Italians are any different than Americans that way.
Sure.
But you see how upset people have gotten in the last few weeks about, I can't have a test for this disease, versus how upset you would imagine they get with, my mom can't get a ventilator. Mm-hmm. I think that's what we're trying to avoid. We're trying to avoid overrunning the hospitals with a wave of suddenly sick patients, and we're trying to avoid running out of beds and ventilators because it all happens in a really short period of time.
Well, then if everybody's going to get it, it seems to me like that we're going to have some strict measures for a while.
Yeah, I told my daughter, who's 15, and bless her heart, she's not having a good month. And she said, well, at least this will be done in a month. And I said, honey, I think we're in for a long run. I mean, I would be thrilled if warm weather comes and we're not seeing this problem and it's better, but I haven't seen anything compelling. I've seen ideas that this is less infective in higher temperatures, and I can't remember if it was lower humidity or higher humidity, but there were some differences that made this virus less infectious.
Now, we could look at China and Italy, though. Again, maybe this is a sign. We know that things have, well, as long as the Chinese are telling the truth, we know that the numbers have come down drastically for them now.
Right.
Italy, at least in the last couple of days here, it looks like maybe the numbers are actually coming down. But again, of course, that's because the behavior is in place.
Well, I think there are two things that have happened in both of those countries. One, they have gotten progressively more and more aggressive about what I'm just going to call population requirements. And two, I think they're through the worst of it. I think this comes up, peaks, and goes down. And I think China's on the other end. The wave of illness has gone through their country, and they're mostly done. Mm-hmm. And Italy, I think, is just peaking. I'm hoping that the numbers we've seen in the last 3-4 days are related to the fact that they're done with their peak. It may be that the sort of draconian societal requirements have finally kicked in as well. I don't know that we know that yet until we get another couple of weeks under our belt and we can see what their curve looks like. But it's this is just different from other illnesses that we've seen because our bodies haven't seen it before. This is scary that way.
Well, Kenny, appreciate it. Appreciate you taking the time to do this and ration out those squares of toilet paper and have fun corn streaming, as they call it.
Nice. Well, thanks for talking. It's a pleasure.